Erythromycin is a medication that is used to treat many different types of bacterial infections, and it can also be used to prevent certain bacterial infections. It belongs to a group of antibiotics called macrolides, and it works by stopping the growth of bacteria. It's important to note that erythromycin only treats or prevents bacterial infections, and it will not work for viral infections like the common cold or flu. It's also important to use this medication only when it is needed, as using it unnecessarily can cause it to not work for future infections. Always follow your doctor's instructions on how to take erythromycin, and never take more or less than the prescribed dosage. It's typically recommended to take erythromycin on an empty stomach, about 1 hour before or 2 hours after meals, with a full glass of water. If you have any concerns about taking erythromycin, be sure to talk to your doctor. When taking erythromycin, it's best to take it by mouth before a meal. It's most effective when taken on an empty stomach, but if you experience nausea, you can take it with food or milk. Do not chew or crush the medication, as it has a bitter taste if crushed. Swallow the medication whole. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. For children, the dosage is based on their age and weight. For the best results, take this antibiotic at the same times every day. This will help you remember when to take it. If you're using this medication to treat an infection, keep taking it until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may cause the infection to return. Let your doctor know if your condition doesn't improve or gets worse. If you're taking this medication to prevent certain bacterial infections, make sure to take it exactly as directed by your doctor and do not stop taking it without their approval. If you experience nausea, vomiting, diarrhea, stomach pain/cramping, or loss of appetite while taking erythromycin, try taking it with food to help reduce these symptoms. If any of these effects persist or worsen, contact your doctor or pharmacist right away. Your doctor prescribed this medication because they believe the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, drooping eyelids, hearing loss, severe dizziness, fainting, or fast/irregular heartbeat. In rare cases, erythromycin may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, seek medical attention right away. Do not use anti-diarrhea or opioid products as they may worsen your symptoms. Prolonged or repeated use of erythromycin may lead to oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. While very serious allergic reactions to this drug are rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist for further guidance. Before taking erythromycin, it's important to talk to your doctor or pharmacist if you are allergic to it or to other similar antibiotics. You should also discuss any other allergies you may have and any medical history of kidney or liver disease, or a certain type of muscle disease. Erythromycin may affect the heart rhythm, causing serious symptoms that need immediate medical attention. Your risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm issues. It's important to discuss all the drugs you are taking and any medical conditions with your doctor before starting erythromycin. Low levels of potassium or magnesium in the blood may also increase your risk of heart rhythm issues, so talk to your doctor if you have conditions such as severe sweating, diarrhea, or vomiting. It's important to discuss using erythromycin safely with your doctor if you have these conditions. Erythromycin may also affect the effectiveness of certain live bacterial vaccines, so be sure to inform your healthcare professional if you are using erythromycin before having any immunizations or vaccinations. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, it's important to discuss this with your doctor, as some erythromycin products may contain sodium. Older adults may be more sensitive to the side effects of this drug, especially hearing loss and heart rhythm issues. It's important to inform your doctor if you are pregnant before using this medication, as it may pass into breast milk. Be sure to consult your doctor before breastfeeding if you are using erythromycin. When taking erythromycin, it's important to be aware of potential interactions with other medications. Some drugs, such as digoxin, can interact with erythromycin and affect how it works in your body. Additionally, there are other medications that can affect the removal of erythromycin from your body, which can also impact its effectiveness. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to ensure safe use of erythromycin. Furthermore, erythromycin can also slow down the removal of other drugs from your body, which may affect how they work. This includes drugs such as benzodiazepines, certain statin drugs, and drugs to treat erectile dysfunction or pulmonary hypertension. It's important to discuss these potential interactions with your healthcare provider. Additionally, it's important to note that erythromycin may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking erythromycin. If you or someone else has taken too much erythromycin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. For Canadian residents, reach out to your provincial poison control center for assistance. It's important that you do not share this medication with anyone else. Your doctor has prescribed this medication specifically for your current condition, so it's important not to use it for any other infections unless your doctor specifically instructs you to do so. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one. Take your next dose at the regular time. Do not take double the dose to make up for the missed one. It's important to store erythromycin at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any leftover erythromycin, you should not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.